Today, I'm going to be dealing with a topic that is so sensitive that I have avoided talking about it. And I had to take a look and I'm going to touch on it. Now, as I said, this topic is so sensitive that I don't think I can leave the full presentation up. So if you're seeing it live, you may see the full presentation. But beyond that, you have to go to my Substack. And it's because I'm touching on something that is so insidious from the pandemic that if you touch it, you will automatically be targeted. I mean, I just had the strange experience of putting the whole thing together, and literally, as soon as I'm about to start, my computer crashes. So I know, thinking, oh boy. But I'm still going to share this with you because we need to reflect on the implications of what has happened in order to understand potentially what is happening. Okay? So work along with me. In order to get this, you have to understand a little bit of science. And I'm going to take you through the science, then I'm going to take you through the facts and link it to the finance. So let's start with some basic scientific information. When the pandemic started in 2020, there was a very specific pattern that occurred with regards to how patients died. Okay, that's where I'm starting from, and this is really important for people to understand from the past. When we look at the timeline of COVID symptoms, the onset of symptoms here is about day 5. Really important. A lot of people don't get this. It's because of the interferon suppression with the virus. The first 4 days, 5 days, oftentimes people have no symptoms, even though if you looked at their scans, you'd see inflammation. This is a critical point to understand. Okay? It's a bit different now, but just follow this principle. Because of interferon suppression, this is what was happening. So then people would start getting unwell here, but they wouldn't really be unwell. They would have, temperature, have a little bit of a cough, and they're okay. And what you would then find is by day 12 to day 14, they were unwell, ending up in hospital, very significant shortness of breath, requiring oxygen, then acute respiratory distress syndrome, we need high doses oxygen, and then ICU. Okay. And this timeline was really important, and it fit with what Dr. Chetty was seeing with about day 8. So onset of symptoms, and then he would find that about day 12, 13, patients suddenly really started to get unwell. That's when he intervened. Really important to understand this timeline. Now, there's a reason why this timeline is so critical in the whole breakdown of everything, because the viral replication is peaking around here and then it starts to come down. And so by the time someone gets into hospital, the viral replication is on its way down anyway because the immune system is dealing with it. But the cause of hospital admission and the breathing problems is not directly the virus, it's the cytokine storm. And the cytokine storm means that that's the immune system overreacting and destroying blood vessels and lungs and so on. Now, my research has highlighted this as autoimmunity, but we'll not get into that at the moment. Just stick with the basic premise with regards to the cytokine storm. And at that time, we didn't really have much options. And so this is early 2020, going to middle of 2020. Patients are dying. That's when the world was in lockdown. And so out come two important pieces of the puzzle in terms of treatment. One of them was through the recovery trial, randomized evaluation of COVID-19 therapy through Oxford. And the two major points that emerged were one, dexamethasone. It was cheap. We knew it for years. And it was showing to produce reduced mortality. And then you had remdesivir, which was a costly antiviral with no mortality benefit, but it had huge financial backing. Now, really, this is important. There was no mortality benefit, but there was a reduction in hospital stay. I want you to think about that. Okay? This one reduces mortality. Now, I remember when I heard that interview where they were talking about remdesivir and they'd done the first study and they said, well, it didn't actually impact on mortality, but we got some reduction in hospital stay. I'm thinking, so what's the point of that? But anyway, it got pushed along. Now, again, you have to go back to the science. And let's just tell you the science again. And this is important to understand. When it comes to the way how COVID-19 presents, I have broken it down into a number of categories. A lot of people were asymptomatic or subclinical. Some people had more of a COVID bronchitis, where they had a lot of coughing. And this is mainly in the Omicron region. Then you had the pneumonia, the viral pneumonia. Now, if somebody already had lung disease and they had a viral pneumonia, if they had COPD or maybe even severe asthma or something like that, the viral pneumonia could cause their lungs to deteriorate and cause them to die. However, for people who had no lung disease, when you get to moderate and severe COVID-19, this was the viral pneumonia with possibly some bacterial pneumonia with microclotting. Microclotting is very unique to COVID, okay? Doesn't really happen in most other respiratory tract infections. They may cause some inflammation and so on, but this disease caused severe amounts of microclotting. And the mechanism of that was tied to the cytokine storm. So, again, remember what I told you is that the viral replication was falling by the time people got into hospital day 12, day 13. So, what they then found is that when you looked at the data, the recovery trial in June of 2020 showed that dexamethasone reduced death by 35% in ventilated patients. Mortality benefit proven beyond doubt. And now I have issues with the recovery trial. That's a completely separate presentation, but this was critical. And so dexamethasone went immediately within days across the whole world. The April 2020 study by the NIH showed that remdesivir shortened hospital stay from 15 to 11 days, but did not reduce deaths. It had no survival benefit, and so the WHO Solidarity Trial dropped it. So you'd think to yourself, well, if that happened, well, how in the world did you hear so much about remdesivir? But again, we're coming to that. One more point with regards to the science, and this is about the microclotting, is that essentially what happened is because of the inflammation in the lung, you would get inflammation in the arteries, what I call a vasculitis, and then little clots would form, which would block these blood vessels, and therefore you wouldn't be able to breathe, because even if you got oxygen down into the lungs, you have no blood to take the oxygen away. And this is why these microthrombi were such a disastrous thing to patients who already had a viral pneumonia. This is why so many patients died. And so understanding that principle about the microthrombi, the cytokine storm, the lung vasculitis is a critical part to understanding what was going on. Now, I'm going to mention a few other basic principles before I go on to the numbers. And as I said, you may not be able to see the numbers live depending on when you watch this, because I don't think they will want me to talk about these numbers. So you'd have to go to Substack. Now, here is what they found from Johns Hopkins. And this was published in August of 2021. And they were looking at the use of dexamethasone versus remdesivir in COVID-19, and it varied widely across the United States. And what they were finding is that up to as many as 1/5, 20% of patients who were hospitalized with severe COVID-19 who may have benefited from treatment with dexamethasone or related drugs were not given such treatment at the height of the pandemic. They weren't given this, okay? Really important point to reflect on. Dexamethasone, even though it was available, they were not given dexamethasone. And you would think, well, why would that be? And the study, in case anyone is interested in looking at the study, Annals of Internal Medicine, this was looking at the breakdown. They were looking at hydroxychloroquine as well, which they dropped off quite early, remdesivir, dexamethasone. I'll not go into this because they really don't like me talking about this. Every time I talk about this, I get censored, but I'll skip past that for the time being. But they were looking at 43 health systems in the United States, almost 140,000 adults who were hospitalized. Okay. And this is the image that goes with it here. And you can see here, I'll see if I can pull this along. This was when they did an emergency use authorization for hydroxychloroquine, lots of use of it, then it fell off. This is when they put out the caution and hydroxychloroquine was taken off the access point. Then they were looking at the use of remdesivir by May. And this box here represents remdesivir use gradually going up. And then you had the recovery trial, press release 16th of June. So suddenly lots of people start using that. Even in the US, goes up to a peak, then starts to come down. Remdesivir stays stable. And this almost makes no sense. Why would they do that? And that's really, really the question that I'm touching on. And as I said, this is a sensitive point. So I am sure that they don't want me to talk about this. So let's go on. If you're watching and listening, you will learn from this. So who benefited from this money trail? So you have remdesivir from Gilead Sciences. The cost per treatment course was between $2,000 and $3,000. Additionally, the US government stockpiled it, billions purchased with regards to remdesivir. And additionally, there was a 20% Medicare bonus payment to hospitals that used it. This is important. Conversely, dexamethasone, which cost $1 to $2 per dose, had no incentives, and there was absolutely no financial reason to promote it. Remember, we know it worked, but there was no financial reason to promote it. And the truth is, as I looked at this, because I have been thinking about looking at this for a long time, but I was afraid to look at it because I didn't want to see what I'm seeing. Even though I knew what I would see now is what was real, I didn't want to look at it. So how did the finance drive these decisions, you may ask? And so what they found, or what they did, and I pause that here a minute. Before I show you that, you need to understand something. Actually, you need to look at this first, and then we come back to the CARES Act. So Medicare, one of the major health organizations in the US, and the CARES Act, we'll come to it in a little bit, offered a 20% bonus payment for any hospital that used remdesivir. So hospitals made much more money for keeping patients on remdesivir for 5 days. On the other hand, dexamethasone had no extra funding. And in the strange way, Because you may think, well, why don't you use remdesivir and dexamethasone? The problem is that if the dexamethasone works, you won't need to use remdesivir for 5 days, and then you don't get the bonus. In the UK, dexamethasone was broadly used. Rarely was remdesivir used because it was so expensive. But in the USA, it was widely used, and they didn't really use dexamethasone. Now, people who work in the US system have to justify that point. I mean, from a clinical point of view, I'm sorry to say, but there is no excuse for a clinician who has patients with severe COVID-19 to choose remdesivir over dexamethasone. I can accept that you want to use it, you have to use it, but you have got to be using dexamethasone with it. You either don't understand the science or you're more interested in keeping the patients on well long enough that the payout comes. I mean, that is absolutely frightening to consider. And I don't want to think that this is the case. But what happened is that the CARES Act, this is the Coronavirus Aid, Relief, and Economic Security Act, came into law in March 27, 2020, and it provided $2 trillion of economic relief. This is across the board. But what was happening is that because hospitals couldn't do their elective work, they were losing a lot of money. And so they had to compensate for the losses by keeping the financial system afloat. And I understand that. You know, in the US, it has a insurance model and they have to be working all the time. It's kind of like planes. You have to be flying all the time with passengers in order to make money. And because they were treating all these patients with COVID, they couldn't do that. They had the lockdown. So you can't expect the hospitals to crash financially because of COVID. So they needed to be supported. And this therefore became the way that I think they went on to be supported. And so you can imagine that remdesivir made billions, dexamethasone made sense. So you have to guess which one was pushed. That's a rhetorical question, of course. We know which one was pushed there. And it shows you just how the system actually works. This is why I said that it's been painful looking at this, because the implications of this, if they were willing to do that, then you know what is off record, what else would they not do? And so in that time there was a lot of lobbying in the industry. The Gilead Sciences spent 2.45 million in 2020 lobbying the politicians. Then they got FDA full approval despite the WHO findings. Then they had government contracts, ensured massive purchases, and then the hospital billing system favored the use of remdesivir over things like dexamethasone. I don't know. I would be really interested, and this is for those people who are digging through everything. Which politicians in the US bought Gilead stocks? And were they at all involved in that decision? Because if they did, they were acting in a financial manner rather than in the interest of their population and their patients. Well, they didn't have patients, so their population, their constituents. So at the end of it, how much really did they make? Did they make a lot of funds? When I looked at it, and I looked at some of the quarterly results here, so they don't only produce, so anybody who's interested can go and look at this, and you'll see 2024, 2023, 2022, 2021. I'm not a financial expert, so I don't necessarily understand all of the numbers, but I was able to see their quarter four. This was year 2020, and it clearly highlights here, as you can see, In that quarter four, they their sales increased by 26%, primarily due to 1.9 billion of Veklury, which is remdesivir sales. So they made 1.9 billion in quarter four. Yeah, it if you I mean, I don't know whether or not to blame pharma for trying to make money on it, because that's what they do, for their shareholders. They would have to do what they do to make as much money as they can. Who is at blame? Is it pharma for trying to do what they do? Or is it politicians for allowing them to do what they do, to take advantage of the situation? Here are the numbers. In 2020, my numbers work out to be about 1.9 billion. 2021, 5.6 billion. 2022, 3.9 billion. Then 2.2 billion in 2023, 1.8 billion. They had countries across the world, it wasn't just the USA, using remdesivir. They approximately made about 15 billion of this. And frighteningly, I could have told anyone that based on the timeline, this thing can't really be effective, because it's not that antivirals don't work. It's just that because of how the virus works, by the time you know somebody is infected, the horse has bolted. They are no longer replicating. Their immune system is dealing with the virus, but they are now sorting out, running into a cytokine storm. And this is why they wouldn't see any mortality benefit. In order to get benefit, they would have had to start it on day one. But how would you know there was day one? Only if you were doing contact. So if maybe somebody was directly in contact and you used it prophylactically, you could then get the benefit. But if you wait for them to get symptoms, that's day 5. By day 8, by the time you put it on board, it no longer has a benefit, because the person's immune system is already dealing with it. So there may be a few patients who have poor immunity that could benefit. That's a different issue. But for the general public, which is how they were using it, that's not right. So the hospitals were financially encouraged to use a drug that didn't improve mortality, didn't save lives, whilst a life-saving drug remained financially unattractive. Now, this is not across the world. This is a unique thing primarily in the United States, but how do they justify that? I'm not even talking about the pharma companies here. I'm thinking about the clinicians who are seeing the patients in front of them, who should have known about the recovery trial. How did they not prescribe dexamethasone? It's not even as if you couldn't. You could. It wasn't like hydroxychloroquine where there was a ban on it. You could have prescribed dexamethasone at $1 and provided extra benefit. So who paid the price? The patients, clearly some, potentially up to 35%. Well, depending on the numbers, 35% to the 20%. So, maybe 8, 9% could have survived, but didn't get dexamethasone or didn't get it fast enough. Hospitals that followed that profit-based system instead of science, and a system that is designed to maximize billing, not necessarily patient survival. What happens when the profits are more valuable than treatments? I think this is why RFK is in position, because this is terrible. As I said, even I had never really looked at the numbers. I knew it was there. I didn't want to look at it, but I thought to myself, I have to look at it now. It may be easier to talk about these things now. I'm sure if I had spoken about that this a year or 2 years ago, you know, they'd probably take down every platform that I'm on. But this is terrible. You know, how do we justify this? How do we move forward from this? Is this what is happening now? Are the same kind of people doing the same kind of thinking now, which is why they're not interested in identifying certain conditions, looking into embalmer's clots? They're more interested in finding a way to make profit off the sickness. So I don't know what else to say. You know, we are in very difficult times. And a lot of people, sadly, are going to have to suffer before anything changes because too many people are willing to be used and abused in this way. They're not asking questions, they're not challenging, they don't care. And so don't expect anything different from a system that has already made billions off you, for which nobody seems too concerned. I suspect they will do it again. So, as I said, if you see the full presentation, great. But if I can't leave all of it up because it's too sensitive, please take a look on Substack. Have a great evening.